Thank you so much. You are really heroes. I don't know, even the work that we do in offices is not as important as the work you do to save lives. The guest of honor, the First Lady of the Republic of Uganda, Janet Kataha Museveni, also champion for safe motherhood in Uganda. The Minister of Health, Honorable Dr. Elioda Tumwesije, the members of Parliament, the RDC, the LC5, the DHOs, the Executive Director of OFLA, the UNFPA colleagues, the religious leaders and community leaders, and dear midwives. From very deep down in my heart, I'm very pleased that finally this day has come. And today, 90 midwives will be commissioned to serve in the Karamoja, Busoga, and southwestern regions in Uganda. Finally, we are making yet another big step to ensure that Uganda bridges the human resource gap for midwifery services. Indeed, what could be more important than one that celebrates the person who supports the process of giving life? Before I go further, I'll take this opportunity to thank the First Lady of Uganda, who is also the champion of safe motherhood, for putting midwives at the forefront. I think this is the right thing to do. Indeed, experience as well as research throughout the world has shown that there can be no safe motherhood without midwives. Midwives are the pillar in safe motherhood. According to the State of the Midwifery Report 2014, access to skilled birth attendants will reduce the risk of a maternal death or and other childbirth-related complication up to 87%. So it means if we just bridge the gap in midwifery, we'll tell a different story in maternal mortality in Uganda. I would like to recognize the leadership and the great work for the Ministry of Health. Our collective efforts are now beginning to show results, as recent statistics show that maternal mortality is going down. According to the UN estimates, maternal mortality stands now at 343, which is almost a reduction of half, but this will be confirmed by the UDHS that is in the review. But I'm sure with all the efforts and all these midwives, especially in these hard-to-reach areas, will definitely make a difference in the figure, in the ratio of maternal mortality in Uganda. UNFPA is very proud to be associated with the progress to address gaps in human resources for health, especially the availability of skilled attendants at every birth. And we're beginning to see significant gains. In a special way, I would like also to recognize the partners. Of course, OFLA, I think, is a mover in this cause. We have witnessed what you have done with the MTCT. I think we can also do this with reduction of maternal mortality and investing in midwifery. I'd also like to recognize the International Confederation of Midwives for their commitments. And we have also to recognize the financial contribution of the government of Sweden through the Embassy of Sweden in Uganda. This year, UNFPA has committed to support the government of Uganda to bring on board 130 midwives to work in the underserved district. 90 of them have already been recruited and have already reported to their duty station. I'm proud to witness this day when they are officially commissioned. I'm glad we did this because usually we just do it and nobody knows that the midwives have gone and they have been trained and they have been deployed. So it's good that champion that you can witness yourself and encourage the midwives, because they have a tough job to do every single day. The focus is on those districts in the regions of Karamoja, Busoga, Northern Region, and Southwestern, and others that are underserved and that had very poor maternal health indicators. We commend the Ministry of Health decision to employ more midwives. We have seen in all the documents that ministry is preparing of late, midwives are given a priority. And this is one very good move, and this will go a long way in improving the midwife to patient ratio and help reduce burnout, as well as ensure quality service delivery. We know that you are strong women, you are strong midwives, you are courageous. And we've heard the testimony. And I hope we can collect all the stories, because we have so many stories that because of time we cannot share today. But I think we'll make sure we document all that and make sure that everyone knows the work that you are doing. The presence of a midwife at the facility will encourage more mothers to deliver at the health center. It will also encourage mothers to attend antenatal and postnatal care, therefore reducing the risk of complications during pregnancy, childbirth, and even after. UNFPA, with financial support from Sweden, has worked with the Ministry of Education, the Ministry of Health, and district local government to establish a bursary fund for midwifery training for underserved districts like the ones in Karamoja. The bursary beneficiaries are bonded. It has already been explained, so I will not repeat this. But suffice to say that we have now a total of 462 midwives that have been trained. Among those, 160 are from the district of Moroto, Kotido, Napak, Nakapiripirit, and Kabong in Karamoja region. So far, 79% have already qualified and have been deployed in health centers. To ensure quality training at the midwifery training schools, UNFPA supported and worked with the Ministry of Health and Ministry of Education to support 18 midwifery training schools with skilled lab equipment and supported the libraries with textbooks. Tutors were also trained to increase the number of qualified midwife tutors. This also was coupled with the equipment in all health center 4s, in all hospitals, in all health center 4s, health center 3, in those target districts, and also the delivery of equipment in the ambulances. Our chief guest, ladies and gentlemen, dear midwives, it has been a long but very rewarding journey at every single step. Our journey continues today, and we are determined to bridge the midwifery gap, and it is possible. We know that when every woman delivers with a midwife, we can reduce maternal death to 0, because we really believe that no woman should die giving life. And the gaps in providing universal sexual and reproductive health, maternal and newborn health care can only be filled when we have skilled, competent midwives with the right attitude. And we heard the midwives themselves saying that they want to change the image of the midwives. We hear complaints about midwives, but they have resolved that this image is going to change from now on, because now they have bigger numbers and they cannot have the same pressure they used to have in the past. I must say that the midwives being commissioned today will be supported by UNFPA on contracts of 1 or 2 years. After that, we agreed with the Ministry of Health that the government will take over. What we wanted is to have the midwives who have been trained not to sit waiting for deployment and losing their skills in the meantime. So we are confident that this is going to help the midwives to have an employment when they finish school, and also while the Ministry of Health is getting organized to recruit all of them in the near future. As UNFPA and the entire UN in Uganda, we renew our commitment to work closely with the government, with the Ministry of Health, to close the midwifery gap and ensure that no woman dies giving life. Midwives, you are our heroes. And you are the backbone of sexual and reproductive health in Uganda. Yes. We shall all support you, and Uganda will be a better place for all of us. Thank you.